The savings are definitely there. According to a GS1 study with the nursing times, a nurse spends on average an hour per shift, so searching for product and supply chain related areas. The LTH spend £1 billion with 154 million on nurses' pay. So the cost to the LTH of lost nursing time is around about 19 million a year. Within order management, between 2002 and 2010, there's been a 46% reduction in the number of order processing staff. But in terms of inventory, the savings are quite significant. In trauma, for example, we started in January 10. May 14, stock was down by 434,000. There are quite significant benefits to gain from having these systems in place, but more to the point in having the data standards and the accurate data within the systems themselves.
Before, the average time spent searching for 5 products was 6 minutes because they couldn't find anything on the stay at the storeroom. After we'd finished, it was just 1 minute at that point. They could go in, go straight to the area, pick it up and get back out, and that's what saves the nursing time. The average time was 3.3 hours a week that they were spending in there. We put it down to less than 30 minutes now. So that's an awful lot of time that nurses are actually spending in theatre and not walking around the storeroom trying to get lost.
In the ward and clinic programme that we deployed last year, we estimated that we saved around 30,000 hours of clinical time, nursing time for the year, which equates to around 15 whole-time equivalents. It's not, the agenda wasn't to take those posts out of the system, but to make sure that we could release that time back to nursing and patient care. And I think the other benefit for us was that, as Scott said earlier, we saw a reduction in stress levels, and actually, just the general tone of the areas improved.
The McKinsey work actually estimated that for a trust of 600 beds, acute beds, an annual saving of £3 to £5 million from the application of GS1 global standards